I'm really thankful to organizers of PFA for inviting me for this session. And I will quickly go through the current problems in poultry industry or the disease problem, what we are facing, and how we can dissect the vaccination schedules. In general, during rearing period, we see the vaccination is fully scheduled. Like every week, we go for 1 or 2 vaccination. And many times we feel that if we miss one vaccination in the schedule, what is going to happen? Am I going to lose heavily or not? So when we schedule our vaccination, now we take our 3 parameters, or we can classify the disease which are very important, or I would say that which cause very high mortalities. There are certain diseases which cause acute mortality and sudden onset. And when the disease is airborne, even the biosecurity is not going to be helpful. And there are certain diseases where prevention of vertical transmission is a must. We have to protect our young chick against AE or Rio or CAV for those diseases, like we have to vaccinate the breeders. And some countries, developed countries like US or Europe, where they do have a salmonella control programs for feed safety. And those vaccines are mandatory. So in this, mandatory diseases like your Marex, Newcastle disease, LPA, IBD, pox or fowl pox, IBH4. IBH4 is essential for the prevention of infection in the parents itself. Those vaccines we cannot exclude. So these are the vaccines which have to be compulsorily we have to give the parents so that there is no loss in the birds. There is no mortality in the birds. The birds are protected. And second category is one where we have to protect the birds, or even if you don't protect the birds, there are effective treatment is available. Like some bacterial vaccines, bacterial diseases like fowl cholera or coryza, where even if we miss out, we can treat the birds when there is a problem. So the next flock, we can vaccinate them. And few diseases like Salmonella gallinarum and pylorum, where the infection is, when the biosecurity is good, when we have a very good rat control programs, we can control the disease instead of going for vaccination. And diseases like ILT, the disease spread very slow. So in this category, those diseases which are spreading very slowly, and there are where we have effective treatment is available. On those diseases, we can keep it as second category. And third category is like on specific cases. In case if we want to market the birds with salmonella free, then we can go for salmonella enteritis vaccine. And problems like avian metapneumovirus or new genotype of ND, emerging genotype, these are the things we can keep it as a third priority or the last priority. Nowadays, we are also getting the problems of inclusion body hepatitis, a different serotype. Conventionally, we have seen only the leachy disease, where we found the problems in early age with heart hydropericardium. Nowadays, we get problems with hepatitis and nephritis. And the birds are not having any fluid accumulation in the heart. And this is specific to the particular parent flock. And because of vertical transmission, we find this problem. So in those cases, like if your particular progeny, any set of progeny is having the problem, only those birds or only those parents have to be vaccinated only against particular IBH serotype. It's not necessary that IBH 8 and 11 should be vaccinated against the parents. Only when there is a particular problem or your progeny is facing heavy mortality, then only you should go for vaccination. This is in brief about the vaccination in breeders. Now we all know that even though we select very good vaccine, the importance should be given for vaccine administration also. Many a time we assume that the vaccine has been given properly. I have seen many cases where Marex disease vaccine, which has been supplied in liquid nitrogen, are thawed at water bath at 56 degrees, which is not at all required, where the temperature of the thawing temperature should be around 25 to 30 degrees. In this case, when the supervisor is mixing or thawing the vaccine at 56 degrees, entire vaccine is lost. So even though we give good vaccine, because of fault in administration, we don't get proper immunity. And second thing is the, the vaccine should be administered which is very close to the natural infection. If you talk about ND and IB, the best vaccination method is by your ocular or respiratory route that is very close to the natural infection. That gives the best results in case of protection. So what I convey here is not selecting a good vaccine. We also take care of a good administration method which gives complete protection against against diseases. And in poultry, we have seen that single vaccine is not effective. Always we have to go for 2 vaccines. There are only 3 exceptions where Marex, AE, and fowl pox. These are the 3 diseases where single vaccine is sufficient. For all diseases, we have to go for booster vaccination because booster vaccine is give you a very high immunity like compared to primary vaccination response. Booster will give very high immune response that will be sufficient to give protection against the diseases. And this technique also helps us in identification of titers. When there is a high titer without vaccination, that indicates there is a field infection, oil type infection. So your vaccine administration has to be improved in this case. Coming to specific disease, of late we have seen there are emergence of genotypes. Earlier, there was only one ND vaccine. Now, of late, we find genotype 7, genotype 13, or genotype 18. Yes. So, genotype 13, 18, like this, there are many serotypes, and this thing will continue in future also because with the these are all RNA viruses, which will evolve like what we have seen in case of COVID. There are many variants which come often. But is it necessary to go for a different genotype for each and every time? That is not required based on the studies. What we see, even though there are many changes in their amino acids, the neutralizing epitopes, the neutralizing one where antibodies are produced against this particular epitopes, which will prevent the multiplication of the virus. So neutralization is really helpful in this case. So not essential that you have to go for different genotype vaccines. However, so like we have many genotype 13, what we have seen in India. This is all based on the geographical reasons. We find genotype 13E in south, B in western part of India, and C almost in Calcutta, which is bordering Bangladesh and China. But all this genotype 13, there are sub-genotypes, they don't require a different vaccination. So the available vaccination with mild tweaking in case of combination of inactivated vaccine, that will be sufficient. That will be sufficient to give protection against Newcastle disease. So in our experience, what we see is the IB in case of Newcastle disease, like all our live vaccines, like whether it is ND, Lasota, or F strain, or clone 30, everything all belongs to genotype 2. When it is combined with the inactivated vaccines, like genotype 13 and genotype 2 combined, that gives sufficient protection. So in our vaccination schedule, we include live and inactivated vaccines combined one that will give sufficient protections during their life cycle. The major problem what we find is infectious bronchitis, where the disease appear in different age group, you will find different lesions. When the IB affects during growing period or during brooding period, it is expressed as a respiratory disease, or you will find only sneaking of birds. But this is the area where this is the time where we find development of your reproductive organs. So these birds, when it is infected during this period, they have a problem during later stage. You will find false layers, or you will find kind of penguin type of abdomen where the fluid accumulation will happen in oviduct, and these birds will not lay properly. So we have to take care of the birds at this early age itself to prevent this penguin chicken or peg abnormalities. Other part, if the IB infection occurs during the laying period, you will find only that egg shape as well as cell quality, or you will say that there's a mild production drop as well as this egg quality abnormalities. Only these kind of abnormalities you will find. Here, the problem is like it is reversible. When you go for a treatment or vaccination, during lay, this problem is reversible, whereas the infection occurred during early age, this problem is not reversible. Whatever we have lost during that period, it will be a huge loss to the birds. And since again, it is again coronavirus, you will find many more serotypes. Mass serotype is the one which we have since 1970s, we got huge problem in poultry, and still it is a major problem. And there are advent of new variants like IB793B type or IBQX, or many local Indian variants are coming. It is not necessary to vaccinate for each and every serotype, because these serotypes will come and go. For short period, they will be in the form. After that, by our practice, the new serotypes will come. Studies have been observed, found that like when you give 2 or more serotypes in your vaccination regime, like one mass and one variant like 783B or IBQX or any other variant, the protection is not only against these specific types, it will give a broader protection. So it's not essential here like we have to go for vaccine for each and every serotype. When we combine, that gives a broader protection that will take care of your multiple serotypes. Then we are all aware of IBD vaccination. Not much debate on IBD. Earlier we were thinking of whether to go for intermediate vaccine or intermediate plus vaccine based on the infection pressure. When we have used intermediate vaccines when the mortality was less than 10% in case of commercial broilers or in breeders where the disease is mild. When the problem is beyond 10%, and if the problem is occurring as early as 12 days or 15 days, then we have to go for intermediate plus vaccines. Intermediate plus vaccines, they have the advantage of penetrating maternal antibodies, and so that the early protection is possible. Whereas intermediate vaccines, they give very mild immune response as well as late immune response. So these are the two things we have to be very careful in selection of the strains. Now with the new technologies like immunocomplex and vector vaccine, we can overcome these problems. Like in spite of high maternal antibodies, they can work well. So the world is now moving towards in vivo vaccination as well as day one vaccination with immunocomplex or as well as recombinant vaccines. So the problem will not be in future, we don't find much. And these 4 diseases like avian encephalomyelitis and avian reovirus vaccines, these are all essential for the progeny protection. Now, even though we don't require for breeder protection, we need this for the progeny because we have to protect those progeny 165 chicks. Instead of vaccinating those 165 chicks, we vaccinate the parents so that sufficient maternal antibody is given to them, the birds are protected. So these are the essential vaccines to prevent vertical transmission in parents. Again, last three diseases like chicken anemia or inclusion body hepatitis type 4 or type 8 and 11, these are all specific. If your progeny is having the problem, only then vaccination is advised. Otherwise, we can skip the vaccine based on the data available, based on the testing procedure, what you follow. With that, we can control the disease. So, in nutshell, the vaccination regimen, I don't say that vaccine, I don't feel that single vaccine or this vaccine is not good or that vaccine is good. But vaccination regimen should be considered as in total against the common disease. You don't focus more on ND or LPA or IB. We have to see all together individually instead of checking them. We combine. We see as a respiratory diseases like ND, IB, LPA, as well as ILT as a one set, along with Mycoplasma, Gallisepticum and Mycoplasma synovium vaccines. And wherever possible, we can combine the vaccines like ND and IB, because both of them can be given together, and there are many more much evidences are that when you give combined ND plus IB vaccination, they are as effective as like single vaccination. In your regimen, like we have to try to include as many live vaccines possible, so that there is an advantage of live vaccine where live vaccine will give all kind of immunity. You have local immunity, you have specific booster as well as cell-mediated immunity. Whereas inactivated vaccines, they give only a humoral immunity. Antibodies only they will be produced. So for many diseases, it will not be protective. So live vaccines as much as possible should be given in the schedule. And besides that, the important thing, what we are missing now is, we give good vaccination and administration. We don't monitor our efficacy of the vaccines. Whether the vaccine is giving sufficient antibodies or are protective or not, that can be monitored by different methodology. One is normal serology and the other one is molecular diagnosis using PCR. I will quickly go through an example of a few things on in serology, where when we see serological graphs post-vaccination titers, we don't see just only the average. We have to see in total, like what is the average, what is the CV, the variations, and the duration of immunity. All three things should be combined together. If you see in this graph, there are three flocks, different flocks. All of the average is same. But whereas this CV, the second one is highly broader, where it could be because of the failure in the administration, where we find the difficulties in vaccination program. And third one, you see there is a two population, which gives a problem like, which indicates there is a exposure. There are two different population. Part of the population is well protected, and second lot is not protected. This is against CV. Yep. Again, by seeing the graphs, you will see that the low titer, average titer, and high titer. High titer indicates there is a exposure to the birds. And again, this graph shows that there is a increase in titers. If the titers are not increasing without any vaccination, that is indicative of exposure. Otherwise, it's a normal case. So this is a case of avian metapneumovirus infection, where the clinical presentation was with egg peritonitis, penguin type of, or the torticollis, and cell abnormalities. When we investigated, we have gone through that there was antibodies, there was no vaccine, but the antibodies were present. Then the production graph was very less. Like you see, there is a big gap between during the peak production, where the hatchery the breeders were losing around 5 to 8 hatching eggs. When the birds are vaccinated, specifically the antibody was there, the response, but the major thing was there was an improvement in production, where the peak production, the loss during peak production was reduced, which has given enough confidence for us that by using the testing along with the vaccination procedure, we can overcome or we can optimize the vaccination schedule. And in addition to that, there are now technologies available where even we can take air samples and we can see the load of particular virus in particular shed, which gives an early warning system in your production flock. In nutshell, the vaccination, the program, what we follow should include as much as vaccine or the vaccines which are essential. Along with that, what we need, the specific target of the flock, that has to be addressed, and that then the effective vaccination should be followed. With this, I finish my presentations. Thank you, doctor. Thank you. Thank you.